Hi, everyone. Thank you so much for joining this workshop tonight on Networking 101 for Public Health Professionals. I'm Carly. I'm the president and founder of the Canadian Public Health Hub. And in terms of what we're going to chat about today, I did take the kind of feedback that you all shared in our orientation engagement. And so we're going to go over just the importance of networking in public health generally, and then how to kind of start a new relationship in the professional realm, as well as go over some tools and techniques for networking, using LinkedIn to the best of your ability, setting up informational interviews, kinds of questions to ask on those once you do set those up, and then also exercises to make the most of kind of your network and building your board. So there's some journaling, some kind of elevator pitches. We'll just take a couple minutes at the end. You don't have to share anything. It's just for you to jot down, but to really try to put the things that we're talking about here today into practice. So, and just as a little disclaimer, these are, things that I did a lot of research on and I'm sharing based on my own experience, the last 6 years working in the public health field. But I am by no means an expert. And so, especially if any of you have any expertise or like lived experience that you want to share, definitely feel free to insert that in the chat or raise your hand, or maybe we can create space at the end too, because really, the Canadian Public Health Hub is about that information sharing, that knowledge translation among all of us. So no gatekeeping here. If you have any ideas or thoughts, feel free to share them with the group. And then, I think in this day and age, there's a lot of thought of like, do I even need to put myself out there? Do I need to network, especially in real life? And I was doing some research on this, of course, and found that there's a statistic that about 70 to 80% of jobs are estimated to be filled through networking. So you might not recognize it now, but knowing someone who knows someone, maybe it looks like 2 to 5 years down the line, could open a lot of doors and create some opportunities. So the way that you're able to expand your opportunities and learn about those hidden jobs and internships and volunteer roles is primarily through networking. It also enables you to build partnerships for your future public health endeavors. So maybe you've decided at some point I want to become a podcast creator. I want to be a public health interviewer of some sort, and I need guests. I need to talk to people in my network, and maybe that's going to be a good starting point. Or maybe you want to become a public health consultant, and getting work and knowing different organizations is primarily done through networking. Maybe it also looks like stakeholder engagement that you're going to have to do in a job or your current job, and just knowing who's out there, the different organizations. Really, that first step is just asking around and getting to know the different, different people and different organizations in the field, as well as just knowing what's out there in terms of the public health landscape. So, types of networking opportunities. Of course, you have your very formal, in-person structured. You can go to a conference or attend workshops and get to know people that way. Oftentimes, people are attending that in groups or as an organization, so it can be a little hard to break in. I've had that experience at some conferences, but not others. As well as just professional organizations and associations that kind of create, after hours to try to get people to meet one another. You can also see informally through alumni networks or peer groups, especially from your university. You might have something from, the whole department. I know for the University of Victoria, sometimes we have once or twice a year something from the Masters of Public Health students as well as the Bachelor students. So that's kind of fun to attend, as well as informally through LinkedIn or even Instagram. Something I've seen is, people that create public health content, doing, having opportunities to travel to conferences and meet the other people that are public health content creators. And I think that's such a neat sphere when you get to see kind of those collaborations. So if any of you are interested in starting that one day, I think it opens a lot of really cool doors. And then, of course, you have your kind of one-on-one, and it could be in person or it could be virtual, but setting up informational interviews is a great way to network, as well as mentorships, like through our MPH Mentors program as part of the Canadian Public Health Hub. And so to first go over in-person networking, so these are pulled directly from the Icebreakers toolkit that we sent out to all of you via email. But you're totally able to save that, adapt it for yourself. I'm not going to read through them all, but it gives you a bit of a heading and general ideas based on the person you're talking to. So if, I think it's really important to change the discussion kind of where you want it to lead, based on how knowledgeable they are in the field. So, if you're wanting to get information from somebody because they're ahead of you in their education, that's a great one. So we've got our education focused, or maybe you're in your education kind of phase right now and you're wanting to shift into a career and you can start asking career advice. And then that way you're just able to really have a goal in mind to gain knowledge from that person. And maybe, you know what, maybe you're just starting a conversation and you don't have an end goal and you don't even know anything about them to start. But I think just being curious and starting with those general questions is a really good start. And then that way you're able to glean where you want to lead the conversation, because really there's something to learn from everybody. And then we also had, you know, I had a lot of people just asking, how do you even use LinkedIn, or how do you network generally? And that's something you can ask in a networking session or, workshop like this. How do you use LinkedIn? Do you recommend any networking groups? So when you're at networking session, it can kind of be this meta experience of like, how have you experienced, trying to increase your network through these sessions? And then there's also just, if you're trying to think about workplace, get an idea about what the organization someone works in, or even just goal setting more generally in the field of public health, we had some headings for that as well. And then in terms of general tips for in-person networking, there was this really interesting study that found that people get really nervous when they walk in. Often these are held in big ballrooms or something like that, so big venues, and people will walk in and get so nervous that they don't take in the room and they just immediately glob onto somebody and sit there with them the whole time. And so even in an hour or 2 hour long networking session, people will often only talk to one or two people, and never even get further through the door. And so this study, the recommendations that they had was, walk your way through the event, try to get some idea of what's going on. Maybe there's some activities that you can participate in. Do you have a goal of trying to jump from different groups? Oftentimes too, they have kind of little appetizers or drinks. And so even just knowing where that is so that you can kind of break from a conversation is really helpful. And then when approaching a new group, you want to have that open body language, and just having something in mind of trying to interrupt, trying to join a group, because there's oftentimes not going to be the easiest way to break in. They won't be like, hey, come over here. So it might be like, there's a quick pause. Hey there, mind if I join? I couldn't help but overhear your conversation about global health or the work you do at the First Nations Health Authority. Sounds so interesting. I'd love to hear more. Is it okay if I join? Or maybe there's an activity or something going, and so you want to try to join in with some other group that's going on. And I think even just being open and real and saying, hey, like, I'm new to the event. I just got here. Just wanted to introduce myself to you. And that's a really good way to just break into a group as well. Because I know it feels awkward. It kind of feels very middle school, high school-esque. But I've attended a few in-person networking sessions, and I think that's just what you have to do. There's, we're adults, but there's not that many times that people will be like, hey, yeah, come over here. I see you awkwardly standing there. And then too, if you want to be that type of person that doesn't necessarily, just glob on at the door to one or two people and that's it for the whole session, trying to think of ways to be genuine and still be able to break off a conversation and not affect that relationship is really useful. So just excusing yourself, something along the lines of, it's been great chatting. I'm going to go participate in that engagement session they talked about, or, any activity. I'm going to go check out the booths. Maybe quickly do that and then come back and see if there's another group you can chat with. But something like that. I've really enjoyed this chat. Just be frank. I'm going to see if I can meet a few other people. I set a goal. I want to talk to 10 people here, but I hope we can talk again another time in the conference tomorrow, something like that. Just having some ideas. Even I'm going to step outside for a moment. Maybe you're just going to look at your phone, try to get your nerves down, whatever you need to do, and then hop back into it. I think it's really good to just have these in your pocket. Because I've definitely been there where it's you just glob onto somebody, or you glob onto a group and you're like, you know what? I kind of wanted to talk about policy, and these people are all, environmental health officers. That is so not my realm. I don't know what they're talking about. So then just having an idea of something to say, you can excuse yourself, and then you find, another group, test the waters. Maybe it's still not the right fit, but you can keep moving on and moving forward that way. And then in terms of LinkedIn, making sure you have a really strong profile before you start reaching out to people is really good. And one of my favorite things is when people put in their bio just a little bit of information about themselves, and especially where they're trying to get more information or where they're trying to explore next in the field of public health. So maybe there's just a little line of, I'm super passionate about early and maternal childhood health, and I'm trying to figure out new ways or new opportunities in the field. Just something general. I think when I have people reach out to me and I look at their profile and there's a little, a little passion statement or a little something to let me know, okay, that's probably why they reached out to me, or it just kind of goes a long way. So making sure you have a photo, your bio, your headline is very clear, and then connecting with intention. So I know a lot of us often want to hit, maybe it's that, you want to hit the 500 plus connections mark on LinkedIn. But being able to personalize those requests, I think, goes a long way, especially if you don't know the person. And then, yeah, that's going to help you build that network and build those numbers a lot more easily than it feels like if I just send a bunch of random ones, I'll increase my numbers. But I think a lot of people turn those down. And so just being mindful of, okay, I'm actually just trying to learn about, I don't know, climate health. And so I'm reaching out to people with climate health backgrounds, and I'm inspired by them, and just letting them know that I think goes a long way. And then, if you're wanting to build up your profile, if you share articles, you comment, you celebrate other people's successes, you actually are viewed more in other people's profiles. So then you'll have more people sending you connection requests. So you're just a little bit more visible, and you're able to build your network that way. And then I think just being strategic of what you're searching, because especially if you're, you want to search climate health, looking up people, MPH, climate health BC, something like that in the search bar will bring forward professionals with that in their bio, and then starting to reach out to them, or especially if you want to set up informational interviews, that might be a really good way to do it, is just being strategic in the way that you're searching. And then I think just looking up templates for those LinkedIn messages can be really helpful, because I know it can be really intimidating just to reach out. And I know I'm personally a bit of an overshare, so then it becomes this long paragraph and you're not 100% sure what to say. So these are just a few that I pulled from online, but this is something that I like as a personal hack. Is if I'm really starting to overthink, I'll just quickly Google, hey, what's a quick LinkedIn template message to connection. So for an initial connection, I think just letting them know why you're reaching out. So you did that search, you're super passionate about climate health, just letting them know that, hey, I think you're inspiring, I admire your work. Let them know kind of where you're at in your career journey. Maybe you're an MPH student, an applicant, you're just starting your career. And then that way, just letting them know that your intention is to connect, so that you can kind of follow them, watch their journey, and then kind of mimic them, I think is a nice way to do it. Also, LinkedIn is a great way for requesting informational interviews. I've reached out to quite a few people, and I've started to have people reach out to me too. And so I think, saying something along of, hi, I came across your profile while I was looking up climate health. I'm exploring the the field and would love, if possible, 20 to 30 minutes of your time. And any advice you might have, let me know if that's possible. I would say maybe you want to connect first and then follow up with that, especially if they reply to, hey, this is who I am, super inspired by you. And even if they just say something short like, thanks, yeah, happy to connect, then it opens the door to, awesome, do you have 20 to 30 minutes of your time? And then if you do have a meeting with them, I think it's really important to follow up and just say, thanks for your time. It was a pleasure speaking with you. I really enjoyed learning about your work in the field. And I think having a bit of a value add yourself, making it reciprocal, can really go a long way too, because they gave you 20 to 30 minutes of their time. And so just showing that, okay, yeah, I digested what they said. That was of real value to me. And I want to try to reciprocate. I want to try to, make it go both ways. So even saying, I checked out that website you mentioned, and it reminded me of this toolkit we reviewed in my bioinformatics. This is just an example I came up with, but I've attached it here. I thought you'd think it's cool, because you're saying you couldn't find toolkits. I don't know, just something that's showing that, yeah, you know what, I digested what you talked about. It was of value to me, and here's a little bit of value that I think I might be able to add to you. And if that's not relevant to the conversation, that's totally fine. But just following up and thanking them goes a long way. Also, people that you met at a networking event, maybe you just quickly, typed their name in, added them as a connection, just saying a little something of, it was lovely to meet you, really goes a long way. And then in terms of, another type of networking, maybe it looks more like one-on-one mentorship style. If you've decided you want to set up those informational interviews, I would say beforehand, research the person and their role if you can. Even if it's just the headline that they have on LinkedIn, maybe just do a quick Google search on that to try to figure out what exactly it is they do. I mean, that can be a question you ask them for sure. But preparing, 5 to 7 thoughtful questions, it really is, the onus is on you to lead the conversation. And I'd say also during the interview, just be respectful of their time. I think, back in the day, it was really, can I buy you a coffee? Can we sit for 45 to 60 minutes? But there's been a real pivot to, even I've had people reach out and they want 10 minutes of my time. And it does feel very respectful. They're kind of on a mission. They know exactly what information they want to get from me. And of course, you want to focus on learning from the person. Maybe they are human resources, maybe they are recruiting, maybe they're the hiring manager. But I'd say just trying to learn about their team or whatever it is you're specifically trying to get out of them. I wouldn't be too obvious about it. I would take a genuine interest. And as I said before, send a little thank you note or an email and stay in touch. Maybe even 2, 3 months down the line, you think of that toolkit or that article and you send it their way. But I think that just really keeps the ball rolling. And so, in terms of also one-on-one kind of mentorship style networking, I came across this really interesting concept of building your own personal board. So very much like a nonprofit has a board of directors, you can kind of have this concept of networking to build your own board of directors. And of course, this is not something you have to formally ask. You don't have to say, hey, can you be my mentor? Hey, can you be on my board? But just having good people in your corner makes the climb to success a bit easier, right? You have people that you can turn to for whatever type of problem, or whatever type of next step you're taking in your public health career, and just being able to turn to them for guidance, for decision making, for a good rant, whatever you need. So this idea came from Jan Teresi Makwa in Building Career Equity, the book. And yeah, instead of kind of just, I think we often think of just, I have a couple of mentors in my life, or I have a few people that I turn to for advice. You really are strategic in, do I have people that lift me up and support me in different ways? Do they have diverse skill sets? So maybe you have, the strategizer that something bad happens, um, I can't even think of an example, but you're at a pivot point in your career and you need strategization. That strategic lens, or maybe you have a job offer or a potential pay increase, or you're negotiating. So you turn to the negotiator in your board. Maybe you have that idea for the podcast and you finally want to launch it, but you don't even know where to start. You need to partner with someone you've decided. So you turn to the relationship builder in your board of directors. And I think we often think these people should be very similar to me. They should be from the field of public health, but they absolutely do not need to be. And so talking with people that are maybe not necessarily even in the field of health or in a different industry will really bring a different mindset. And especially, I know a lot of the folks in the Canadian Public Health Hub are women, and so especially having women that have gone through maybe corporate jobs and then are higher up that can give that expertise is really handy. And then also just being in the MPH Mentors program, you're also potentially building your board. Maybe your mentor is somebody that could become one of the people on your personal board of directors. And then tips for just networking in all forms. I would say just stay in touch. I know it can be tough. Maybe it was someone that was in your bachelor's degree or your master's degree, a past supervisor, but just having a little touch point can make it really handy when you have to go back to those people in the future. And you never really know, maybe they'll become a hiring manager and they'll want you because they thought of you because you stayed in touch. Or if someone wrote you a reference letter, and just letting them know, did you get the job? Did you, get into medical school, whatever it is? Or are you going to have to be applying again? And you'll need their support next year or in a couple months' time. So just staying in touch that way, I think, is really helpful. Also, just letting people know that you're in their corner and cheering for them, just congratulating people on achievements. If you saw something in the alumni newspaper or you saw something on LinkedIn, just send people a little positive note. And that's a really good way to kind of just keep your name popping up, and just a positive connotation with you. And then also just having, articles, opportunities that when you think of someone, let them know, reach out to them, send that email. Have that value, make it kind of a reciprocal relationship, whether you're the mentor, the mentee, whatever that looks like. I think just being willing to help and support somebody in their work, again, really goes a long way and has that positive association with you. In terms of networking do's and don'ts, especially if you are going to an in-person event and it's just kind of or virtual, but just, you're meeting people for the first time, doing a bit of a roundtable information sharing on yourself, having a bit of an elevator pitch can be really handy. So it's just 1 to 2 sentences about who you are. And especially if you have a goal with attending these sessions, maybe you have an initiative and you're super passionate about it and you're trying to figure out what the next step is, or you're trying to get people on board, letting people know about that can go a long way. And one of my favorite quotes is just, you never know who's in the room. And so say, it can be tough to be vulnerable and put it out there that I want to start that public health podcast and I have no clue where to start. But there might be someone there that is an expert in that and will want to help you. Or maybe they're also doing the same thing and you can be accountability buddies or something like that. So, taking that first step and being vulnerable can go a long way. Being genuine and just showing a true interest in others, having that mindset of, okay, there is something to learn from everybody, and just asking follow-up questions on the things they share can really build those relationships. I think also just having a few questions in your back pocket before you go to an event, especially if it's an in-person one, you're a little nervous. I attended a networking gala last year, and that was a really hard one because I was at a table with people that all knew each other except for me. So having a little something thought about ahead of time goes a long way, even if it's just something as simple as, where are you based? Like, what organization do you work for? What brought you to this event today? I would say in terms of networking, no matter what your goal is, do not ask for a job directly. I think it's also important not to overload people with questions because you want it to be reciprocal. They want to learn about you just the same. So even if you are really curious and nervous, I would say just don't go to that icebreakers question and go down the list. But let it kind of go back and forth. And maybe there will be an awkward lull in the conversation, but I think that's okay. Um, and then don't forget to nurture those long-term connections. Have those little follow-ups, those emails. I'm thinking of the time I hadn't been in touch with the professor who wrote the reference letter for me to get into my master's of public health. So it had been 2 years, and I don't think she knew where I was. And so I reached out to her and let her know that I had signed up for the 3-minute thesis competition. And she was my inspiration because I had watched her do hers when she was doing her PhD. And we've still been in correspondence since then. But it was just a nice thing a couple years later I felt guilty for letting that drop and just re kind of kindled that connection with her. Um, and then, like I said, just don't make it too one-sided. Um, for sure, if you're trying to get information from somebody, a mentor, somebody with knowledge, there will be a little bit of one-sidedness. But if you can offer anything, even if it's, wow, thanks so much, that's so interesting, you're so impressive, something like that, can also go a long way instead of just like, okay, yep, that's the information I needed, thanks, bye. Um, and then, you know, I've had quite a couple people reach out just in terms of the Canadian Public Health Hub. And I even had some folks drop out because they were so intimidated by networking, by talking to their mentor, by setting up that relationship. So I just want to say any of you here today, anyone watching this back, just you're putting yourself out there, and I think you should be really proud of that. Don't overthink it. Don't be anxious. I would say as the biggest tip, just be curious. Sit, listen, ask follow-up questions. It's not solely on you. Even if it's just one-on-one, there's two people there. And so the responsibility doesn't solely lie with you. And I think that should give you a bit of comfort. And, it's hard for everybody to network. And so I think that should bring some comfort too. And putting yourself out there, that's going to make such a big difference to your education, your career, wherever you are in your journey. And so with the last little bit of time, might be more than 5 minutes, but we are going to do a little exercise. You do not have to share it with the group. Do not worry about that. Um, but this is something I haven't honestly taken the, time to do for a while. And I think it's good to have it, um, you know, at the forefront of your mind, especially if you're going to set a goal to do some networking this year. So we're going to take a little bit of time to just develop a bit of an elevator pitch. And so we'll walk through that. We're also going to just do a little bit of setting a goal for yourself for the year or maybe for the quarter, whatever you want to do, of just one way you're going to put yourself outside of your comfort zone to do some networking. And then we're also going to brainstorm our board of directors. So no stress. If you want to put it in the chat at some point, awesome. You do not have to. You do not have to share with the group. I know when I hear, we're going to do an exercise and you have to share, it gets my heart racing. So I'm not going to put any of you through that. So in terms of an elevator pitch, we're just going to take a few minutes to think about this. So feel free to grab, a pencil, a pad of paper, maybe if you want to do it on your laptop, whatever you want. But you're going to think about that elevator pitch, and maybe it's one line, maybe it's super short. You don't have a goal. You're not trying to, get people's money. You're not trying to get them to sign you up in terms of a public health consultant. But just think about, where you're at in your public health journey. So what's your name? If you have a title and role, if you're a student, wherever you're at, and then let them know what you do. So if you're part of an organization, you've got a project or initiative on the go, what's the value add that you are trying to let people know about? And then also why it matters, the impact or significance of your work, especially as it relates to public health. If you're going to a public health networking event, people would be super interested. And then a call to action too. Why, how do you want to get people interested? What do you want people to remember? Think about like you're truly on an elevator, you're riding down, the doors close. You have a little bit of time while you're moving between the floors, and when the doors open, you want to have a lasting impact. And I would, in terms of tips, I would keep it short and sweet. That elevator ride's not very long. So think about 30 seconds, 60 seconds, something like that. And really just the value of the work you do. Don't make it no jargon, not too technical. I wouldn't include a bunch of acronyms or anything like that, but just try to be authentic, try to be genuine with it. So, I was playing around for myself. Hi, I'm Carly. I'm the founder of the Canadian Public Health Hub, a platform dedicated to empowering public health students and professionals through a free community. That is very long to share knowledge and support one another in advancing our careers and advancing the field. Okay. Um, I'm very bad about run-on sentences, so I wouldn't necessarily take mine as like absolute perfection. But I think I love to share my passion with people. So I'm passionate about making information easily accessible, and we do this through free workshops, mentorship, and networking opportunities. And if you're interested in being part of the hub, I'd love to chat more. So just a little something to get people to understand, where you're at in your journey. What are you currently working on? Why should they care? Oh, that sounds, your passion is similar to mine. You know what? I'm going to check out the website later or sign me up, send me an email, whatever it is. So we're just going to take a few minutes. I'm going to stop rambling. And yeah, you can start kind of jotting that down for yourself of who you are, what you do, why it matters. Maybe you're just a student. Maybe you're just letting people know what the next step that you're interested in so that the calls to action is potentially they send you, you know, some information or they let you know about a cool job opportunity they find. Even something like that. It doesn't have to be a calls to action of the thing you're going to do for people, but maybe you want them to do something for you. So again, sorry, I'll stop blabbering. We'll take 2, 3 minutes. I'm going to give everybody another minute. We just had somebody join from the weight room. I just wanted to let you know that we're working on an elevator pitch. So there's just a bit of information there if you want to grab a pad of paper, pen, pencil, whatever you want. We're also going to do some networking goal setting next, but another minute or two for everybody just to put some thought into a personal elevator pitch that you might use at a networking session. Okay, it's probably enough time. I do want to create space. If anybody feels super keen and wants to share it, I will pause for like 10 seconds, but I'm not going to force anybody because I personally would not want to. So I'll just create space if anybody's super keen and wants to practice.
I can start.
Sure.
So hi everyone, I'm Monica. I'm a first year MPH student. I'm currently working at the Northwest College as a casual health science instructor. So what I did matter because I feel like I'm helping out the future healthcare workers get ready to the healthcare system. So I consider myself as contributing in the health promotion and health education. I love what I do now, but at the same time, I want to explore more areas in public health, especially like research opportunities and opportunities working with organizations. So if you have any ideas about those, and if you want to share with me or any advice you want to give me, please feel free to contact me.
I love that. Thank you so much.
Thank you.
Um, yeah, I loved the context that you gave at the end there too, like the why it matters, but also your personal call to action. Because I think when I heard that you said you're an instructor, I was like, oh, Monica's so knowledgeable. She's way above me. I have no value to add in this conversation, right? I immediately was like, nope, she's way above me. I'm useless, like intimidated to speak to her. But knowing that you want to explore the field, the areas that you're interested in, yeah, I think set the stage for potentially, a lot of kind of flow of conversation with the people at a table or at a networking session. So that was wonderful. Thank you, Monica. Is anybody else interested in putting themselves out there and practicing their pitch real quick before we move on? Okay, hearing none. Thanks, Monica. Really appreciate you participating in that. We'll move on to the next little activity. So just spending a little bit of time of setting a goal for ourselves. Maybe it's, you can put a time frame on this. I think I put for this month, but it doesn't have to be. Just thinking of something you want to do 2025, this quarter, the next 12 weeks, this month, whatever. The step that you're trying to take in your career. Take a second to think about that. So maybe you're looking for a new job, maybe you're trying to, figure out which Masters of Public Health program you want to apply to. What oh my gosh, what type of what I was working on this in between my eye surgeries. If I'm being fully honest, I had the idea to start the Canadian Public Health Hub after one eye surgery, and then I was all patched up working on these ideas. So I probably meant to say what type of information, I just couldn't see at the time. Do you need to take you there that you're currently lacking? So you've got the goal. What kind of information do you need? What could you get from networking? Um, and then that will kind of help you strategize. So maybe your goal is to connect with 2 to 3 public health professionals on LinkedIn. Maybe it just looks like setting up your bio or starting a LinkedIn account. Maybe you want to set up one informational interview because your goal is to change from, you're working very project management-y, but you want to work more boots on the ground maternal early childhood health programming. So you've looked at people that are doing the work that inspires you. Maybe it's in the same province, maybe it's in the same town, and you want to set up a little one-on-one informational interview with them. Maybe you've decided you want to join a public health association of some sort, or a public health networking group. And I do have a few examples at the end because there's a few spaces I joined last year and had a blast networking at. I think my goal for myself last year was to just attend 10 public health networking sessions online. And I did that within 2 or 3 months time with the different kind of cool programs that are out there. So I'll share that at the end. But just being strategic, taking a couple of seconds first to think about where are you at in your career? Where are you at in your public health education journey, wherever you are? What's the information you're lacking? And then what's the best way to get that through networking of some form? The different forms that we talked about today. So I'll again stop rambling and you all can take, a minute or two just to jot it down. And maybe you've been doing that while I've been talking, but again, I'm going to stop rambling. Hopefully I've given you all enough time. I would also, recommend that you're making sure that you're putting yourself outside of your comfort zone, but not too much of a stretch. I realized too last year, I think it was 2 years ago, my goal was go to 10 networking virtual sessions, and I did that. So last year, then I decided I would do 10 informational interviews. And they are they're intimidating, and it's a bit of a skill to develop. So I think I did five, and just felt so burnt out. I felt like I was exhausting myself mentally by trying to find the right people and reaching out. And it was a cool exercise to put myself out there, but I didn't even necessarily have a goal in mind. And so trying to just make sure that it's realistic. You're not going to burn yourself out, but you're still tiptoeing that line of that comfort zone and trying to develop a bit of a skill set that might help your career. And so I'd say just keep that in mind. And then for our last activity, we're just going to reflect for a little bit in terms of again, apologies for the typos. I was working on this with one functioning eyeball with my eye surgery, but board of directors. And so, it does not have to be the roles that I've outlined here. So I was just looking at in terms of that book and what was recommended. So maybe you're thinking about a mentor, so someone that has more experience than you and can offer a bit of guidance. You could also think about a peer, so someone that's at the same stage and can offer mutual support. So maybe you just had a day, it's your boss again, you just want to rant. Maybe it's someone like that that's appropriate, totally understands what you're going through in the field. A challenger, so someone who pushes you to think critically and step outside of your comfort zone, that really, believes in you, but is very passionate themselves about growth, that growth mindset, and wants to see you succeed and push yourself outside of your comfort zone as well. A sponsor, so someone who actively advocates for your success. And, there's definitely some overlap here because a sponsor is usually someone who has more experience than you. So it often sounds like a mentor, but maybe it's more that professor that writes that reference letter for you, or, you know, that supervisor from the last job that was so excited to hear that you got a promotion and moved on, something like that, which would be a little different than a mentor and someone who you typically go to for advice. Um, and then an advisor, so someone that has especially that specialized skill set, that specialized knowledge, that can be useful to your growth. And this does not have to be in the field of public health. It could be someone in a different industry, like we talked about with the board of directors slide. Could be somebody that has expertise in leadership. Maybe you want to apply for a manager position and they're a leader themselves, so you want to turn to them. Maybe, they've had a ton of experience across the field of public health. They've done health promotion, they've done, environmental health, and you want to be able to switch around and glean a little bit of information from them. So you could think of it in terms of those roles. And then I would say just take a couple of minutes to think about who currently maybe sits in those roles for you. And do you have any aspects of your board missing? Did you ever have somebody in that position? Has there been movement recently? Is it somebody that you just haven't reached out to for the last couple of years and you could send a quick email? Would that be a good thing to restart that relationship? And then also thinking about, that strategy, that where am I at in my public health career journey right now? And what type of advice or information am I not getting that I could try to fill? Also, are these people challenging you? Are they encouraging you to grow? And so we'll kind of create an action plan at the end, but yeah, just take a few minutes, and I haven't even done this myself, so I'll do it in real time with you, to think about your board of directors. And if these five titles do not fit you, I was seeing some other ones online. So feel free to just quickly do a search or even ask ChatGPT, whatever you want to get some ideas and brainstorm if these five aren't fitting with you. But again, we'll just take a few minutes to think about those. hopefully that was enough time for everyone. I just started to chicken scratch. Um, Feel free if you want in the chat to jot some ideas down. But this was a really good exercise for me as well, something I haven't thought about. And it was interesting to reflect on, are certain positions missing. Because I had a couple of mentors recently that I've reached out to, and they're not replying, and I'm not quite sure what's going on in their life. And I was wondering if, I should be moving on. And so I kind of put a little star beside that position on my board, whether maybe that the time has been served for that board member and I need to find someone else. I definitely was seeing some past supervisors of mine in different jobs kind of pop up. In terms of peers, especially, I jotted down a couple of people from my Master's of Public Health program that I just haven't stayed in touch with, but have wanted to because, we used to kind of talk about where we were in our career and next steps and get all excited. And we haven't done that for a year or two. So, this is a good reminder for me. I want to reach out to them. Um, and for me, kind of the sponsors in my life, I think are more my past professors, the people that have written reference letters for me. Um, and I realize I think advisor and challenger are kind of a little bit lacking. Like I have ideas of people who I would turn to, but they're more so family and friends and not necessarily, career professionals, people that are able to provide as much guidance as I think I might want, especially, if I'm trying to think if I want to do a doctor of public health versus a PhD versus, applying to medical school, people that I could talk to about that, or, one day starting a public health consultancy, what kind of folks I could chat about with that. So, hopefully this was a useful exercise for you all as well. Um, we have a couple more slides, but yeah, thank you for kind of staying, for joining, for those kind of three pieces of the activities and participation aspect. And then final little bit, lots of opportunities are out there for virtual networking, especially in the public health field. You just have to know where to look for them. And so something I wanted to share, because when I went on that tirade of, I want to get better at networking virtually and I want to learn about people in the field. Of course, we have, the Canadian Public Health Hub. We have our 2 networking sessions a month. So I just want to put a little plug out there. Please attend those. Sometimes they're a little sparse. Other times there's 20 people, but there's, great connections happening there. I don't know if any of you have heard of the Public Health Millennial, but my friend Omari Richins is the founder and creator. He also has the Public Health Millennial Career Stories podcast. So if you're ever, he is based in the States, so it is a little bit targeted more for that demographic, especially there's a CPES, there's a designation that you can get for like public health educator, and a lot of people on his podcast have that, which we don't get in Canada. That's not a thing that you can get in Canada. So definitely different context. I would just, kind of warn you, but he's a really great facilitator of conversations. And the Public Health Millennial has a free networking group called the Public Health Happy Hour every month. And actually, for those of you in the session live right now, it is tomorrow at 3 p.m. I'm going to be there. I absolutely love his sessions. And if you go to his website, so the phmillennial.com, it's a free community. They just started a book club and they're going through it live. There's, Omari does a ton of free workshops, very similar to what we're doing with the Canadian context here. So highly recommend you join. It's free. There's a networking session tomorrow at 3 p.m. Pacific Daylight Time. And also the PH Spot is another neat place. So that's hosted by a woman named Sujani. If you've ever come across her on LinkedIn, she has, I think, like 15,000 followers, maybe more. And She also hosts the PH Spotlight podcast. So that it's a little bit more, she's Canadian. So a lot more of her guests are Canadian, and she talks about kind of the different opportunities that are out there if you're trying to advance your public health career. And they, from what I recall, is they do have virtual free sessions probably every 3 months or so, because otherwise it's typically paid, and it's it can get a little bit pricey, but if that's something you're interested in, I used to pay for a subscription. I did it, committed to it for a year for myself and found it really helpful. So I'm also happy to chat if anybody has questions about that, but highly recommend, kind of checking out these free online networking spaces, and even just try to follow places like this on LinkedIn so you get a notification when they're hosting their next networking session. It's a really good way to kind of practice putting yourself out there without the formality of, going to a conference or anything like that. And so with 5 minutes to spare, that is the end of the workshop. But are there any kind of questions or comments from anybody? Especially recognizing this is just coming from my experience from the research I did based on the questions you all asked in the orientation engagement session that we did. But if any of you have your own kind of tips or tricks, please feel free to put it in the chat or unmute yourself now. I'd love to hear it. If there's anything that I may have missed. Oh, thanks, Sarah. Appreciate it. Okay. Well, hearing none, I will stop the recording there.